you shortly as we hear your presentation. So thanks to you also. Any comments on the May meeting minutes that were sent out in advance? Okay, if not, we will accept those as presented, and thanks Sharon very much for putting those together. So Lillian, shall we go ahead and get into work session 1?
Yes, we shall. Kelly, I'm going to make you presenter. Wait. No.
Oh, she's shaking her head.
I don't really have anything to put on the screen, so if you make me the presenter, that would not be good. Unless, do you not have documents that I sent?
Oh, I do have the documents, but I shall put them up. 1 second.
Okay, and the first one's going to be the square footage. I want to just talk a little bit, and then we'll start with the square footage.
Okay.
Okay.
1 second.
Either Kelly or Lillian, will one of you sort of set this up for the committee as far as what, and maybe it's you, Kelly, what's going on with the CCEC and child care rules and all of that?
I will be happy to do that, Sue.
Okay.
So my name is Kelly Walker, and I'm the Child Care Policy Manager and the Co-Child Care and Development Fund Administrator for the state. And with me here in the room, I have
Peter Bloom. I'm a project manager with the Early Learning Division.
And Peter is part of our team that is working on a major overhaul of our child care licensing rules. And we've been meeting diligently for months and many, many hours to try and re-envision our licensing rules. In November of 2014, the President signed the Child Care and Development Block Grant Act of 2014, and then subsequent Child Care and Development Fund rules came out. So much of our rule change has to do with the reauthorization of the Child Care and Development Fund. As we work through our rule sets, there are a number of areas where actually we've done engagement for a number of years on different parts of our rules. We've had recommendations on a variety of areas of our rules. And it's just really important to us. I was listening to the radio yesterday on the way home, and they were talking about the federal health care law and how there is a lack of public input and public engagement on the new law. And how important, and I think it was John McCain said, how important the policy discussions are. So we are really grateful to have a group of folks who are going to be focusing on the equity components of our rule potential and really look at, what are these new rules going to do for us, and what harm could they cause, and really help us evaluate how, especially in a couple of different areas, we can have a better equity lens on the rule set. So there are two conversations that we would like to have with you today, and there may be more coming up, but these are two that seem to have a lot of, it's just really challenging, especially when you have limited resources. And when we look at who our customers are, first and foremost, it's children and families. But we have additional requirement to be supportive of our child care workforce, as well as the contractors who serve the child care workforce. So I'm really happy that the early learning hubs are represented, and Carmen is here from Multnomah County Child Care Resource and Referral, because you folks are at the core of making this work. So the two areas that we're going to be talking about one is the square footage requirement added to registered family child care. So I'll talk a little bit about what the Caring for Our Children standards are. And Caring for Our Children, for those of you who may not know, is kind of the Bible when it comes to early childhood standards in care settings. So we're always looking to Caring for Our Children to guide us in our decision making, but then we're pulling in all of the other resources at our fingertips to make a determination about how changes in rule will affect individuals So, and then Peter is going to lead us in a conversation around staff training. Part of the Child Care and Development Block Grant Act of 2014 did require states to have additional have ongoing training requirements for their workforce. We already have those in place. They are woefully less training hours than are required in most states and territories, with the exception of a few. And so Peter's going to talk about the recommendations for that and really ask for your input on impact of those. Did that capture what you wanted me to as far as setting it up, Sue?
Yeah, Kelly, the other piece is to know that the input that we provide today will inform you and Peter, as well as the Child Care and Education Committee, which for now is the rulemaking committee for the council. So it's a process, but this is a really key part in the CCEC, the Child Care and Education Committee, and council specifically asked for information and input from this committee. So that's great.
Thank you, Sue. And some of this has been, we worked with the Child Care and Education Committee on some of these rules, and we will continue the conversation at the next meeting of the Child Care and Education Committee, particularly on square footage and staff training and qualifications. So this will definitely become part of that conversation as well. So it looks like, does anyone have any questions or need clarification on that before we launch into square footage? Okay, I've waited my requisite 8 seconds. And feel free to raise your hand or stop me at any point, and Sue or Lillian can stop me and ask questions. So what you see in front of you and what should have come to your inbox is a document that's titled, "Should Square Footage Requirements Be Added to Registered Family Child Care Provider?" There's also an equity lens response to the 8 questions that Peter drafted for you, so you have some idea of the thinking that we had when we started to develop this rule. We talked to a lot of our licensing specialists who are in the homes, the family child care homes. And for those of you who may not know, registered family child care is a type of licensing where you can care for up to 10 children in your home. 6 of those children can be preschool children. The Caring for Our Children standards on square footage requirements basically say that you need usable floor space of 50 square feet per child, and that is the preference in the center and home environment. What we found is, there's very few homes that are going to have 50 square footage. When we've done our research on other states, the average and a number of states, and I will eventually have all 50 states, I don't have that quite yet, but most of them are around 35 square feet. There's a few that are 25, and I think I found one state that is 20 square feet. And if you have any difficulty envisioning what that looks like, a 14 by 10 foot living room is 140 square feet. Once you add furniture, which is not considered usable space, that room gets much smaller. So at 100, and I'm not going to be able to do this math, Peter, so you're going to have to help me out. 140 square feet at 35 square feet can serve how many children? Peter's doing the math. And while he's doing that, what I want to say is that we found that, and if you look at the different kinds of options that we've put in here, not changing any of the square footage requirement would obviously have no impact on providers. 4? 4. Okay, so in 140 square foot at 35 square feet, you could have 4 children comfortably. What we find in many of the homes we go to, if they have a good-sized living room, they may only do care in one room. And you could have up to 10 children in a room that could be 140 square feet. So if we look at option 1 and do nothing, they would continue to care for children in small spaces. There's some pros about it, and that one is obviously that the revenue for the child care provider could continue. And the cons are that children further from opportunity and children who are in small spaces, and that often happens in urban areas with small apartments as well as single-wide trailers, which is what we're finding is the smallest spaces, is they don't have the opportunity to experience environments and to do small and large motor skills and really achieve the social emotional development that a space offers children. A second option that we have is the square footage option, the 35 square feet of indoor activity. It aligns with the caring for our children better. It doesn't quite meet the 50 square foot that they recommend, but it better supports the cognitive, social, and emotional needs of children. There would be a financial impact on providers who providers would have to accept fewer children. So if their square footage was only 200 square feet, they would have fewer children that they would love to have in care. We think that approximately, and we didn't have a real scientific way, but we talked to our licensing specialists who worked in urban areas and also who maybe serve a lot of our second language speakers, and really thought that probably 30 to 50% of providers would be affected. Obviously, low-income providers and folks living in apartments would be disproportionately affected, and it potentially could impact providers of color, especially Hispanic providers, is what's been reported. We have a third option, and maybe I should stop. Yes.
This is Sue. I am not connecting something here, because if our current standard is 50 square feet per child.
No, our current standard is not. It's the caring for our children standard. So it's the Cadillac standard. It's the guide that everyone goes to see what is best for children. So best for children would be ours. We don't have a standard. We have nothing in rule right now. I'm sorry I did not make that clear. We don't have any square footage standard in rule, and it's something that we've been contemplating for a number of years, especially when you go into a licensed family child care home, and what you realize is it's a very small room with lots of furniture, and the children have no space. So it's really important to us to look at this. So we don't have a standard, and we need to create something.
Okay, sorry, I may have missed that, but that's a very important thing to know. Okay, so
I probably didn't make it very clear. So, you know, I live and breathe this stuff every day, all the time, and I just always assume everybody knows what I know. So thank you for stopping me.
We do have square footage requirements for certified family and certified center,
yes,
which are 35 square feet of available interior space per child, but there are no requirements currently for registered family, and that's what we're looking at.
Yeah. And we won't be changing our requirements for centers and certified family. And there's also an outdoor space requirement for our certified facilities of 75 square feet per child. So those components are already in place, but not for registered family. Okay?
okay, and that helps a lot to know that we have a 35 square foot standard just for another group of providers. So thanks for adding that information, Peter.
Sure. Does anyone else have any questions on the first two options that I presented? And I want to really talk about all four of them before we go back and have conversations.
Okay.
If that's okay. Okay, so a third option could be to do a minimum of 25 square feet of indoor activity area. That the space, you know, would have to be fully able to be used by the children. There can't be any, you know, heating units or equipment, any space that's not usable by children. sometimes we have people ask if they can use the space under their cribs to count as square footage, and that's just not really usable space. So we estimate that about 20 to 25% of providers could be affected by this. Again, low-income providers and individuals living in apartments would be disproportionately affected, and it could impact providers of color, especially Hispanics. So there are some positives. It provides some minimal square footage requirements, and considering that we have none now, it would be an improvement. So it's better for children. Not as many providers would be as impacted as the 35 square foot rule. But again, there's less alignment with best practice. The 35 square footage for us feels like a pretty good minimum, and there would be some financial impact to providers. It's important for us, since no matter what conversations we have, we're looking at resources. So we also looked at each of these options and what types of additional resources would be required on the licensing specialist, because going in and measuring a room in a facility just takes time. And we need to map, like we do in certified facilities, and have a map of the space that will be used by children. Okay, so the fourth option, and this is what some states do, if the available space to children is 140 square feet or less, that we would limit the number of children in care at any one time to 6. So oftentimes you'll see states have child care rules that will cover up to 6 children and rules that will cover 7 to 12 children. And one of the key differences is in the square footage. So if you only have a certain amount of square footage, you're limited to care for 6 children. There are some other things, and I was thinking about this morning. Some states will have a limit of 6 children, but then you could have more infants in care. And that could offset a financial, but that's a different rule. So I'm not going to be really talking about that today, but it is one of the considerations that we make as we're evaluating all implications of setting a new rule. So if we did require different option 4, you could care for up to 6 children in 140 square foot environment, which we talked about earlier, really would be 4 children at 35 square feet. So we figured that the impact on providers would be about 5%. So it'll be a much less effect on providers, and more than likely would only affect single-wide trailers or for providers who limit care to a small area of their home. And there are some providers who may just provide child care in their bedroom, or, like I said before, in a living room area. So those are the 4 options that we've come up with, and I would welcome you to, and Sue, I'm hoping that you can prompt the facilitation of this, but really look at the pros and cons. I mean, we have pros and cons that we put in. We'd like to hear more from you about what you really feel the impact would be, and really help us get to a solution that we can then bring to the Child Care and Education Committee and eventually the Early Learning Council, that will really provide the best opportunities for children but not have a devastating effect on the providers that care for them. So, any questions?
Will do. Kelly, just one other piece of information, and then we'll go to questions. To give us some perspective, how many registered family care providers are there in Oregon?
There's about 2,200, I believe, at the moment. It kind of fluctuates, but somewhere between 2,200 and 2,400.
Okay, so just so we all know, this is affecting a lot of people. And I assume they are spread all over the state.
Yeah, and to put it in perspective, I think it's important that family child care has the largest numbers of businesses, but cares for a relatively small number of children. So you could figure if they cared for 10 children, we're talking about, and we have 2,000 providers, we're looking at 20,000 children. Centers, on the other hand, there may only be 1,300 centers, but care for the majority of children in Oregon. So this is a smaller number, but it also affects, there's a lot more family child care in rural areas. And Carmen is here from the Child Care Resource and Referral, so we can always pick her brain too, because she's right there at the front line working with providers.
Okay. All right. So thank you for the background, and let's open it up for questions as well as comments from any committee members.
Can I ask one quick question? Look, is this being recorded, or does somebody take really good notes, Lillian?
It is currently being recorded. All of our meetings are recorded.
Okay, it's really hard for me to talk and write at the same time, so thank you for that.
Yes, and who has, yes. Kelly, were you going to speak? Yes, Kelly Poe.
I have a question. So I'm wondering, do we have someone that represents the licensors out of the child care division, and what impact this would have on those field staff that have to go out and measure all of these 2,500 homes? Because I know it's our licensor in Eastern Oregon is just on a dead run all the time now, and to add this, I'm just wondering what the impact is. I'm not saying pros or cons. I just want to know where this falls.
And we did talk to a number of our licensing specialists, and our licensing managers were part of this research and came up with the pros and cons and really looked at what the impact would be. And yes, the 35 square footage measurement on the first round would, to catch up with all the facilities, would be definitely a workload issue. I mean, not one that we're not willing to do, especially because of the benefit to children.
I guess I'm concerned because we're having a hard time keeping up with the current workload. So, I mean, we're having to schedule out weeks in advance for visits.
Yeah, this would definitely require us to come up with some solutions about how to do that. And it could be something that we implement over a period of time, so that we're not, I mean, we're not going to be making extra visits, and so it will be something. And you know, they have the laser measures, so there is some ways we can simplify the process for licensing staff.
And Kelly, I'm just wondering, would you consider that such a big issue that you would suggest we not put in any standard? Is that kind of where you're headed? Or you just want us to be aware of the fact that there would be a staffing impact?
Is that Kelly Poe or Kelly Walker?
Kelly Poe. With her comment, I'm just wondering where you're heading.
Yeah, I'm not heading anywhere. I really seriously just wanted to know what kind of a load it would how it would play out. That's all. I don't know. I'm learning.
Okay. Okay. Other comments and questions? This is a very important time to give some input back to staff and the other committees.
I mean, my initial thoughts are that there should be some standards, but I would be leaning towards options 3 or 4, just based on, you know, the impact that those standards would have on providers and families.
And I'm wondering what your experience is at KinderCare, and both you and Kate. Welcome, Kate, by the way. I introduced you before you got here, so people knew that you were joining our committee. So welcome, and thanks for being on the call. But I'm wondering if either Rochelle or Kate has any input from how you, what your standards are, how you run your operation. Kate, I think you're muted. Sorry.
Sorry. I was actually, as I was listening, I was thinking through like what potential standard we have in place, regardless of whether it's state required or not, and was actually reaching out to a facilities person just to see what we use as our measurement, so I could share that back with the group, because I think it'd be a good at least baseline to work from.
Yeah, thank you. That would be
Yeah, absolutely.
great information to get.
Yeah.
Thank you.
Of course.
Okay.
Hi, this is Katie at Latino Network, and I also really appreciate, you know, the thoughtful analysis of these different options. And given the potentially higher impact on providers of color, especially Latino child care providers, I would advocate for option 4. I think that it's really thoughtful consideration of the square footage in terms of the benefit to children, but I think looking at family stability and access to providers who reflect the cultures of the kids and the families, that's something that's really, really important. And so looking at all of the factors that support, you know, that healthy early childhood experience and development, I would hate to see us sacrifice one really important piece around culture and familiarity for the other, for the space piece.
Yeah, I would like to see maybe if there are ways that we could support providers in learning how they could better utilize the space that they have rather than restricting based on space.
Okay. Good point, Rochelle. Other comments?
Yeah, this is Carmen. Yeah, like CD said, I love the options that are work that's gone into putting all these options out there. It's helping frame this thinking for me a lot. And to respond to Rochelle's idea of, you know, helping people use the space that they have, I think that's a really interesting thought. But then I want to go back to the question of that someone else had brought up about whether or not the licensing specialists have the capacity to spend more time to help people with that. And if it did go to that TA as opposed to more regulation, then I know that the R&Rs with the funding cuts would also be kind of stretched to do that one-on-one TA. Yeah, just something to consider there.
Carmen, this is Kelly, and I just want to say I really appreciate that, and I think that an important conversation, especially when we move into the conversation about training and registered family child care providers, resources are really important to consider. What I would say is that licensing specialists now will talk to people about space and how to create better space for child care children. However, and I'm just thinking about a situation that somebody talked about that they went into on Friday. The care was provided in the living room. There are couches around the living room, and even if it was a 15 by 15 foot space, in the middle of it was a large dining room table. So really, children have this tiny space around the dining room table for all of the activities. And there is just not much you can do with that space. And, you know, we think about all the considerations that we have in these rules and talking about different pieces, and it's really heartbreaking to go in and see no space for children to move. So a licensing specialist can do what they can, like suggest they move the dining room table, but there may not be anywhere to move it to. So it's, you know, and I also really appreciate what, I don't know who it was, but the idea, I think it was, I don't remember who said it, but I wrote it down. Hate to sacrifice one for the other, and I think the same is true. We don't want to sacrifice the ability of the children to play either. So it's tough.
Okay. Any other comments? And we need to kind of keep moving because we still want to circle around to Peter and professional development. So other comments and input, this is really, really helpful. Joyce, just to put you on the spot, I don't know if you have any thoughts about this.
Well, you know, I see both sides of it because it's important that the children have a place to be. And there certainly would be disadvantages to not having space that's conducive to developing all of the skills and addressing the social and cognitive needs of children. But I think that there comes a time when you've got to say, well, we don't have, this particular place may not have the optimal amount of space that we would think about, but on the other hand, I think the quality of having a space at all and having providers is something that is also very important. Because my whole thinking is, what happens if these children didn't have the space, however limited it might be, and have a place and space to be? Mm-hmm. So, I mean, I think all of the comments that have been made have been good ones. But, you know, I lean more toward trying to help the providers and the people who do the licensing be more of a support to help people figure out how to best use the space that they have. And so that's kind of where I lean, because I've seen spaces where, you know, kids could hardly touch, but what was happening in that space was so important. It was more important to work with the person to say, well, have you considered doing this? Is there different types of activities that can be done in the space that you have? So it's a good discussion. I mean,
okay.
And I like the breakdown of looking at the pros and cons, and maybe there may be some additional things that can be added to the pros and cons that would help in making decisions.
Right, and hopefully that's part of what this conversation is leading to, is Kelly's getting some additional information as well as emphasis. Kelly, I think my last question would be, do registered family child care providers have the option of just not registering so they don't have to come under any of the regulations?
Mm-mm.
Only if they care for 3 or fewer children.
Otherwise, they're supposed to register.
They're required by law, yeah.
Okay.
Yeah, and I think
But they're only caring for children from one family. There are some exceptions.
Yeah, I guess the only additional piece of consideration that I would put in there, especially as we're thinking about just unintended consequences around some of the minimum square footage requirements that's proposed here, as the housing crisis across the state is slowly but surely growing, and especially in our metropolitan areas, if I'm thinking about it, as families are being pushed to smaller and smaller homes, which disproportionately impacts low-income families. There could just be unintended consequences if we had high minimum square footage requirements with families' abilities to take care of children at all.
Right. Really good point to throw in add the housing situation as another consideration.
This is Carmen again. I had a couple more things to add just for people to think about. And I'm also feeling to lead off the things I want to add in, I'm finding myself feeling really conflicted in that I want to make the choices that we're considering just straight across the line what's best for children. And I'm finding it really hard to look at, to think about what, even to consider that we might have to make compromises to that and able to have the supply of childcare that we need in order to have the range of childcare that we need. So I just want to put that out there, that what I'm that's a conflict that I'm having internally. But things to consider, I'm just looking at some numbers. I also want us to consider that it wouldn't probably be just Hispanic providers should be affected by the restrictions on space, but also the refugee and immigrant populations. So right now I'm looking that we have 15 Somali-speaking RF providers, and 11 of them have apartment numbers in their address, so that would be the majority of those providers who would likely be affected. And then the other thing to think about with option 4, which seems to me the one that I'm leaning toward, is you remember that the maximum, if it says the maximum number of children in care at any one time is 6, that includes the provider's children. So if you had 4 of your own kids or 3 of your own kids, which, you know, I don't think it's that uncommon for providers to have 3 of their own children, they can care for 3 additional children to that. So if you're going from a limit of 10 to 6, I mean, you can count that they are caring for their own children if you're considering the need for childcare does actually include statistically that provider's children. But it is just so people are aware that it's not like they're having income from 6 families outside of their own if they have 6 kids. Does that make sense?
Yep. Yeah.
Okay. Just something for us all to have that image in our mind of how that math works, that it isn't a cutting down. Okay, now I have 6 clients. It's actually probably only 3 clients.
Okay, good reminder, good information. Okay, I think we'd better move on. If other people have other pros or cons or input, please send it to Lillian, and we'll be sure to, or Kelly, but Lillian's probably the contact we all have.
So this is Kelly Poe. I had a question.
Yeah.
Where do we make a recommendation? I mean, do we have a process here of identifying one of the options that we support versus the others or not? Because I listening to the comments, like I said in the beginning, I'm just learning, and what I'm realizing is that there's going to be a disproportionate impact on my high poverty, very rural areas, especially. I'm really struggling to get providers engaged in Wallowa County, and this will be one more reason for them to not engage. And our focus has been on raising quality, and we really want that quality care. As some of the folks have talked about, the engagement that's going on in those family homes is wonderful, and we really don't want to lose them as providers. And I'm really concerned that this is going to create a pretty big barrier in my region. So that's where I'm leaning. You asked in the beginning if I was leaning one way or the other, and I guess that's where I'm leaning now. I'm not seeing the benefit.
Can I just say one more additional piece?
Just one sec. Let me ask Kelly Poe a quick question. You're not seeing any benefit of putting in any square footage requirement, Kelly, or no benefit to what?
I'm not seeing a benefit to creating the rule. I guess I was leaning, you know, as the conversation was going, I was looking at option 4, but I think about our specialists that come out and work with our providers. I guess and our child care resource and referral that really struggles to have the capacity to do the workload they have now. I really want to keep our relationships with our providers as positive as possible and really engage on the relationship between the provider and the children and the activities they're doing, and I'm not seeing a benefit. I'm just not seeing a benefit to creating a rule.
Okay. Okay, thank you for that clarification. Kelly?
Just a quick follow-up to Kelly, and I think that what you'll find is 35 square feet is, in a regular standard home, is not as large as it seems. So you may find that in your area that the proportion of providers who would be affected by a square foot rule is very small. And I just want to point out how important the rationale on this is, and welcome you to look at that. And then the last piece I'm going to say is we are taking notes and we'll bring the comments and information that you all share back to the Child Care and Education Committee as part of the engagement work that we've done. This is on the books to be talked about at the meeting in July, and we will bring information from this group back.
Thank you.
Okay.
Thank you very much.
Yeah, thank you, both Kellys. And then when it comes back to us and we see where the CCEC is heading, so we'll get that feedback again. And then if the committee wants to weigh in on it, whatever, if we want to take a formal action, we certainly can. And I don't know if anybody feels so moved right now, or if you're comfortable sending our input in, letting CCEC work with it, and then taking a look at what they have. Is that okay with people? Okay, hearing no opposition to that, why don't we do that, and then know, Kelly, that we'll want to get the next iteration of this from the CCEC would be great. Thank you. Okay, Peter, let's go to the staff training, which is also a very, very important topic.
And I'm just going to frame this up for you real quick, because if you'll notice on our staff training, we focused on family child care. And part of the reason we did that, and what we know on our conversations around training, is that we do have a number of family child care and certified family child care providers whose first language is not English. So when we look at equity and in our training, it really felt important to us that this was the place to focus equity conversation. Peter's going to lead you through the conversation, but I just want to reiterate that for us, this is going to be a resource issue, and helping us figure out how to guide the conversation and look at the resources are going to be very important, especially if we think about investing in language training for child care providers at the expense of providing or having an infrastructure for training for providers in, let's say, rural areas. So it's really a dilemma, and Peter's going to talk you through it.
Hi, everybody. So my name is Peter Bloom, and with starting off with the Caring for Our Children standards, and this is for family child care. So the Caring for Our Children standards recommend that for small family child care home caregivers, they should have at least 30 clock hours of training per year. Currently, for a registered family, we require 10.
Every 2 years.
Every 2 years. So it's quite a disparity between what the national Caring for Our Children standards are and what we currently require. But to jump from 10 hours every 2 years to 30 hours every year, we determined would be too much of an impact on providers, and also the resources aren't available to be able to provide the amount of training required and the accessibility of that training to all providers that are out there. So one of the proposals we came up with is to increase it to 15 hours every 2 years. So it's a small increase, but it does get us closer, at least in the direction of what the Caring for Our Children standards are. And one thing we noted, and you can kind of see it in the rationale there on the first row, the recommendation that we got from the Professional Development Committee and OCCD, which I can never remember.
Oregon Center for Career Development.
Oregon Center for Career Development. I apologize to them for not remembering what the letters stand for. They recommended that we increase the training hours to 20 hours. We went to 15 with our initial proposal, because if you look at the rationale, it doesn't include all the safety set training, which is first aid, CPR, food handlers, and recognizing and reporting child abuse and neglect, which could exceed 5 hours of training to keep those current. So if you were to include that, it would exceed the 20 hours that are recommended by CDC and OCCD. So since those aren't included, we came up with a number of 15, would be a number that gets us in the direction, but hopefully would minimize the impact on providers trying to seek out the additional training. And one thing I do want to point out, and I do have some actual numbers here somewhere, I'm not sure if I can find the actual numbers, but it does, the average number of training hours that a registered family provider does take per license period, now this is an average, not every provider does it, does exceed the current minimum requirement of 10. I believe it is, for small home-based, I believe they have, trying to find it here really quick. Oh, here I go, I got it. For small home-based, the average provider takes about 15.9 hours of training per license period. So that already does exceed our current requirement of 10 and does also exceed the proposed requirement of 15. But again, that's an average, so not all providers do that. Some do just the bare minimum. So that's where we're at now. There are some additional things on, yes ma'am.
Just a quick clarification, that's 15.9 hours every 2 years.
It's actually annually.
Oh, it's actually annually?
Yeah, the number, the average training hours for small home-based providers in the state is 15.9 annually.
So if you go that over to extrapolate that over a 2-year license period, that would be over 30 hours of training that the average small family child care home provider attains in a 2-year period. So that's far in excess of what we're currently requiring or proposing to require.
And in fact, that is what the national standard is, or this caring for our children standard is.
Yes, well, they're requiring 30 hours per year, or recommending 30 hours per year, which would be 60 hours over a 2-year license period.
Okay.
We need to be really careful, though, in saying that the average is higher than what's required, because just because the average person can afford to take more classes than is required doesn't mean that everyone can.
Absolutely, and we can certainly understand that the average is not, it's just an indication, but it's not representative of all registered family child care providers.
And this conversation will really need to take into account how it may disproportionately affect providers of color and low-income providers as well.
And
I do want to point out, certainly.
Go ahead.
Well, I just wanted to point out really quick that, I'm sorry, I'll stop talking.
No, you go ahead. I'll let you finish.
Well, I just want to point out just so really quickly that the additional 3 rows that are on the document that's in front of you talks about at least 2 hours must be in guidance and discipline, 4 hours in program management, and 8 hours child development or early childhood education. So those don't increase the training hours. Those are just part of the training hours. So really the focus of the discussion should be, do we want to increase the training hours for registered family child care providers from 10 to 15? The other 3 rows do talk about components of it, but not in addition to the 15 hours. They're part of the 15 hours.
I'd like to ask a question about those 3 rows specifically. Are trainings available, sufficient trainings available to meet those requirements in languages other than English?
Is this Sadie speaking?
Yes.
Okay, thanks.
And Sadie, this is Kelly talking, and I'm going to let Carmen jump in here as well. We do have a number of trainings, and we have all the statistics that I'd be happy to send to you of trainings that are available in the 5 languages. And I don't have it right in front of my face, but we have a number of trainings available in Vietnamese, Chinese, Spanish, and then additional trainings that are interpreted. Is there ever enough? No. But there's also, we don't expect that our child care resource and referral program and we as a state will have all the training that everyone needs available at any time. There are so many different training options online and other venues and correspondence that can also serve as the training. But specifically, I would like to hear from Carmen about her experience in Multnomah County with languages.
And can I just maybe clarify my question?
Sure.
I'm speaking specifically to the requirements that are called out here, the 2 hours on guidance and discipline, 20 hours in program management, and 6 hours in, 8 hours in child development and early childhood. So wondering if we're considering a new rule, I'm wondering if there's access for people to comply with that, specifics of that rule.
So are you asking if the state will be providing that training? Because what I'm saying is that we are one of the venues to get, and the training is available out. I mean, it is out there. I think it's much more difficult for folks with languages, especially in the higher level trainings. But you can get 8 hours in child development if you speak Spanish here easily.
Well, I guess.
Yeah, go ahead.
Sorry, this is Lillian. So I guess something that's coming up for me right now in this conversation, I think there has to be, for the implementation of this, we know currently that, you know, it is harder for individuals that speak a language other than English to receive these higher set level trainings. I'm wondering within the implementation of, you know, if this moves forward, the support and intentions specifically from the early learning division around supporting building capacity around, one, we know that across the state we need to build the capacity to execute especially level 2 trainings in languages other than English, and I don't want the conversation to be kind of positioned, we either have trainings in languages other than English, or we lose opportunities to do trainings in possibly in rural areas, which was the conversation the piece of the conversation that started off this conversation. It sounds like, one, there's a capacity building piece that we need to have as a basic infrastructure around this, so that it's not good, in my opinion, it's not good enough for us to say that, we can, someone can get 8 hours in Spanish if they have to travel across the state for those 8 hours. It sounds like we have to have additional conversations around the capacity across different regions in order to support this, so that we won't disproportionately put providers that speak a language other than English, which is a benefit to our early learning system, at a disadvantage to meeting this requirement, which I think is a good requirement to increase, capacity and learning and development of our providers across the state.
Yeah, this is Carmen again. Lillian, I think that's so true. And CD, I just want to thank you for that question about whether or not we have the capacity to do this, is it actually available? And I can speak to that a bit as the R&R in Multnomah County. But again, I'm feeling a little bit, as Lillian said, that maybe if we don't quite have this capacity, that we're changing the system by changing the number that we're requiring, as opposed to actually changing what is systematically available to people. And I think that if we put the cart before the horse, that's when we just further alienate people from being part of the system and from quality improvement. In Multnomah County, I would say that while my main concern is that we need to think about the math that actually goes into this, which is that we're talking about new classes a year. So when we say that people are required to take training, they can't take the same training that they've taken before, which makes sense. But what you're asking is that there is new classes available to people, and people aren't going to be able to attend every single class that's new, right, because they have other things going on. So So for example, to support the Chinese population, to take new classes a year, there's 55 of them, so they would need to take at least 2 new classes a year, which is 4 training sessions provided by the R&R. So I guess I'm kind of curious, like, what math went into figuring out, not to put you on the spot, Peter, but I guess I would like to know that we, before we make a change like this, that we actually have gone through and done the math to see how much would it cost a provider to take that newer trainings, how much would it cost our training system to provide those additional trainings, adding up what people are actually paid, if there's translation, what that's actually paid, what does it cost to hire the trainer, and all of those pieces. I don't want us to guess that this will work. I want us to use at least the data that we have.
I understand exactly what you're asking.
Really good feedback, Carmen. Thanks.
And it sounds as if that that level of analysis hasn't been done yet. Is that correct?
We've played with the numbers, and unfortunately, there's only one pie, and it will just prioritize how it gets cut when the final decisions are made. I think it will help us get more creative in our delivery system. But I think that Carmen's right. I mean, we only have one community that has this high number of Chinese providers, so we really are looking at one community to develop training. And I think we have some other options for Spanish that we can evaluate. But yes, we know.
Yeah. So this is Carmen still. Sorry to dominate the airwaves, but I just feel like this is an issue that we can really speak to from our experience here. And the conversation that we've had as a committee over the last couple of years has focused so much on being culturally specific and responsive in what's available and what is prioritized for our workforce and for children. And I just want to keep on that and just keep reminding us of things like that understanding and guiding behavior is very culturally specific. It's also an essential piece of quality childcare. So I love the fact that that is a requirement that would be involved in upping the number of training hours that people need to have. But at the same time, we just need to look at the reality that what I would do in my home is not appropriate for me to train on across cultures. So there is some additional cost and some time involved in providing that. And the same thing for program management, that people are having really different, an English-speaking provider who's providing care in, inner Southeast Portland has totally different program expectations and challenges than someone in a rural area. Or in order to have it be relevant, I'm saying it needs to be relevant to the area and to the cultural group as well.
Thank you, Carmen. This is Sadie. I just want to offer one more comment, and that is that a community council was recently just formed to expand the master trainers, the pool of master trainers to be more diverse and representative. And that, that will take some time, but it's building capacity in the system. So one way of looking at this situation that I would suggest we consider is for the state to invest first in building the system to support providers in accessing this training, rather than creating the requirements before the system is ready to provide the support to help folks meet that requirement, because otherwise we set up these unintentional barriers when some really good work is happening to try to build the system at the same time. But our timing, we could perhaps trip over ourselves as a system.
That's a great point, Sadie.
This is Kelly Poe. I just wanted to echo what Carmen had said as well, but I want to talk about some of the cultures that exist, especially in Wallowa County. It's an isolated county that, again, we're just really struggling to have child care providers engage in quality. There's no CCR&R staff in that county. The staff are connected to either via phone or they have to drive into LeGrand, which doesn't happen very much. And to increase the hours, I think it's going to have an impact on our CCR&R ability. I think our focused child care network is equipped and has the capacity to do these hours the way they're lined out. So it's a capacity issue for our R&R system, at least in my 3 counties.
And this is Joyce. I just want to kind of reference what was said about additional groups, particularly immigrant and refugee groups, and particularly Somali and some of the African immigrant groups. It's become quite a talking point on our African American Black Student Success Plan Advisory Board. We have 2 Somali advisors, and they have made some very compelling points about the need for that particular population of students. So I don't want us to not kind of consider the ELL needs of children who don't speak the languages that are represented under that equity considerations box. I think we need to, and the other thing we also found out is that at the state level, when there's talk about ELL, those groups aren't included. So I just wanted to point that out, that we also need to look at how do we meet the needs of children who don't speak the languages that are represented here.
Joyce, what did you say the name of that organization is?
Oh, it's the African American Black Student Success Plan Advisory Committee. This is under House Bill 2016.
They may have some helpful information for us as well.
And also, luckily, I'm a member of the committee.
Yes, you are.
Great looking at. Okay. Good input. All right. Well, I certainly hear a lot of concerns and caution, I think, on the timing and the capacity, system capacity, more than a question of whether, more professional development would be good, and having the breakdown in these different areas would be good. So I'm not sure, Peter or Kelly, if you can give us any feedback as far as whether staff and the Child Care and Education Committee are kind of looking at this as a 2-step process where we need to figure out how we can help leverage, I think, an expanded capacity, because it sure won't all be state funded. We know, looking at what's going on at the legislature, it's not a very rosy picture for early childhood. So are you all looking at sort of this 2 stages of capacity building and then perhaps changing the requirement?
Thank you, Sue. I think that if we weren't, we are now. We really have been grappling with the training hour component of our rules for a number of years because we are so woefully behind most other states in the recommendations. It's like Carmen says, you really feel conflicted because we want the opportunities and we want the infrastructure, but which will come first, the cart or the horse? I mean, we have really good trainings out there right now that are getting canceled for lack of participation. So, we have infrastructure. complex like all of our issues are. We don't make anything simple here, but all of these points that you folks are bringing up, we'll definitely consider.
Kelly, that's an interesting point. Do you think the classes are not filling because of the cost of the classes, or what's the assessment of why that's happening?
You know, it's interesting. I worked at the Child Care Resource and Referral 20 some odd years ago, and we had the same issues then, and Carmen could speak to this better, but I think that the trainings are actually very low cost, and, you know, in your investment of $10 for a 2.5-hour training on guidance and discipline, and regardless of what language it's in, after you've worked an entire day with 10 children, and the time comes to leave your house at 6:30 to go to the training, and you just say, I can't do it. Of course, it's more complex than that, but you know, it's easy access training in some areas, and sometimes we just don't get the numbers. Then we have to cancel classes because it's, you know, you can't run a class with 2 students who paid $10. You can't even pay a trainer for that. And you know, while the state provides infrastructure, the funding, the resources can't pay for the entire training. I mean, enough training for every person who needs it. Does that kind of answer your question?
Yes, and Carmen, do you run into that much in the big, dense metro area?
Sorry, can you repeat your question?
Oh, I'm just wondering if many trainings get canceled because of lack of registration.
We don't tend to cancel very many trainings because of lack of registration, but we also run trainings with very few people in them. So we sometimes do run them with 3, 4, 5 people, and then just try to make that work financially. Partly because sometimes those are trainings that are in areas that people really need them. So if you cancel it, then they just don't have that opportunity. So for example, if you only offer, you know, a couple of program management trainings in the quarter, and then one of them is canceled and there isn't another one that quarter, then there isn't another opportunity. So, but yeah, they do have, some of them do really have low numbers. And I know that other R&Rs, because they're smaller, don't have the flexibility to run it with that, with lower numbers.
Right. So just as we look at the global picture of trainings, that may be another piece of this puzzle to look at, is how do we at least fill up the classes that are being offered, since it's unused capacity, but the capacity seems to be there.
This is Joyce. I'm thinking just, you know, based on my training experiences as a training provider, are there any incentives? Has there been a really deep discussion to kind of take a look at what are the barriers to people participating? And I could certainly say that, you know, even with 10 kids all day, the last thing you want to do is go to a training for 2 hours at night. So, I mean, I think maybe, as someone had mentioned earlier, we need to do a deeper analysis as to what may be the problem.
Mm-hmm. Yeah, because sorry, this is Lillian, because I'm thinking just in general when we're thinking about some of those barriers. For example, we know many of our providers have children themselves. Is there childcare? Is there food at these things? You know, what are these other things that we need to consider that may be getting in the way, the sheer timing of it, or for particular communities, what would be the best timing for those communities that we're trying to engage more often, and knowing that, you know, I know our programs across the state, they're doing some form of that analysis, but I do think that kind of those basic analysis would help when we're thinking about how do we make sure that we're optimizing the trainings that we do have so we don't have those cancellations.
Right.
This is Kelly Poe. I can share a couple of things that I know that are working and we're struggling with delivering our training. I know that our CCR&R will do training for one person if that's all that signs up, and that's critical. Our Focused Child Care Network has created a retreat process, so she will take about a dozen, 8 to 12 providers, and they will leave on a Friday afternoon when the children are picked up, and they need to leave town. So because if you stay in town, you're still connected to family and work, and so they do a real retreat. And for us, it's easy to go to the mountains, and so they go to the mountains. They have Friday night through Sunday afternoon, and they do a jam-packed weekend full of training hours. They'll bring in a master's trainer. They create workshops that are designed to meet the needs of the providers, and it's just been hugely successful. And I would say that one of the biggest reasons is the providers see it as a good use of their time, so they're not going to sit in a building at a table doing desk time for 2 hours. They actually, those 2 hours are spent hands-on. They go home with projects and tools that they're ready to implement in their child care, and they're just rejuvenated. And the byproduct is the relationships between the providers, and I know that's not what we're talking about here. We're really talking about professional development, but it's been hugely successful. I think that we've had 8 portfolios submitted recently because we're getting so many training hours in, and people are working through the QRS. So anyway, I think that there are some out-of-the-box ways of delivering these professional development hours in the language and in the culture of our providers, but it takes out-of-the-box thinking.
And Kelly, this is Kelly, and the other Kelly, and I just want to really acknowledge and appreciate, what you've said, and actually acknowledge and appreciate the Child Care Resource and Referral Programs, because they are charged with doing an amazing amount of work with really limited funding. And so I think there's a lot of out-of-the-box thinking. There's a lot more that could be had, and it's a struggle. It's really a struggle with the languages for us.
This is Joyce, and I think what was referred to earlier about, the out-of-the-box thinking, that's what I was thinking in terms of professional development. I mean, it's hard to get certified professional development for professional educators who don't always want to come to the same old thing. Taking people out of their environment has always, in my opinion, and based on my work, been a good thing to do, because you get people away from, having to worry about doing the laundry and going back and feed people, and it really changes the mindset and the thinking. And that's what I was suggesting, taking a look at what have been some of the barriers, what are some of the incentives. And when we incentivize, it doesn't always mean giving people money. I mean, there are other things. And engaging the broader community and helping to support this kind of development of people who are providing services to our young. And so I'm just thinking about how can we think of ways to engage our providers in wanting to participate in the opportunities that are made available to them. And I think it's something that in many situations has worked, where you get people, I mean, if I'm an English language learner, I'm a provider who speaks a language other than English, and I know that I'm going to have an opportunity to be engaged in developing some skills and some practices that will better me in terms of being a provider, and I know I'm going to be able to understand what's going on, I might be motivated and even excited about the opportunities to have that professional development. and to have things that may be a little, different than what's been done in the past. So I think that the professional development, I personally think is really important. I think having people, be able to look at how to do things better and even differently and innovative is something that needs to be worked on.
Okay, we are going to need to move on to healthy families. Michelle, do you have a final comment?
Yeah, I just wanted to kind of echo what Ms. Joyce was saying. As someone who's been a teacher and who's been a director, the requirement of training hours does not incentivize teachers. So really having something that motivates teachers and that lets them know that these training experiences are going to be relevant and are going to be things that they can use to improve their practice and make their work easier is really important. Back when there was some financial incentive to the ORO steps, that was an incentivizer. And like Ms. Joyce said, it doesn't have to be financial, but there has to be something, there has to be a better carrot than just required training hours.
Right.
Okay, thanks. Thank you. All right, sorry, but we've got to move on to healthy families. Hopefully, Peter and Kelly, this has been helpful feedback that you can take back to staff and then also the CCEC.
It's been great. Really, really good feedback. We appreciate your time, and we're probably going to sign off.
Thank you very much, everybody.
Bye.
Thank you.
Thanks, both of you.
Thank you.
Okay. So Erin, are you on the line?
Yep, I'm here.
Perfect.
I can turn on my webcam. There wasn't space before, so let's see if this works. Hopefully. Hi.
There. Hi, Erin.
Hi.
Welcome. Thanks for joining us today.
Thanks for having me.
I'm going to make you the presenter if that's okay.
That's great. Yeah, I've got my slides up ready to go.
Perfect. Here you go.
Okay, so Erin, if you would just sort of set the stage for us as far as the accreditation process, where you are in it, and what sort of input you're hoping to get from the Equity Implementation Committee today, that'd be great.
Yeah, so can everyone see my screen?
Yes,
Okay, when I make the presentation full screen, all your faces went away. So hopefully you can still see me and you can see my slides.
Yes.
Okay, so thanks for having me to present a little bit about Healthy Families. I'm going to kind of just do a quick overview of our Healthy Families Oregon system for anyone who's not quite familiar with it, as well as an overview of Healthy Families America, kind of where our programs are, who we serve, and I'll kind of go through that relatively quickly. Talk more about the accreditation and how I'm hoping that we can utilize your committee to kind of provide some feedback and input and help us. So I'll go ahead and get started. And there we go. So just some real quick history. Healthy Families in Oregon actually started as a program called Healthy Start back in the early 90s with 7 pilot sites. Originally, we were funded through the Commission on Children and Families, and we served only first birth families. So parents having their very first baby were eligible. By 2003, our program was statewide, and in 2005, the state Commission on Children and Families decided to move in the direction of trying to be accredited by Healthy Families America. We were we call like pre-2005 that we were Healthy Families-ish. We kind of used their model, but kind of didn't fully embrace it yet. And so in 2005, the program really started moving towards implementing all of the standards to accreditation. In 2007, our state system became a fully accredited multi-site system. There are only 6 or 7 states in the nation that are actually accredited state systems. Most healthy family programs are kind of standalone programs sprinkled throughout the country. let's see, and then 2012, we went through reaccreditation again, and there was new legislation that opened up the eligibility of families who could potentially be eligible for services to all births, not just first births. And then our name was officially changed to Healthy Families rather than Healthy Start, and we moved under the Early Learning Division. Now, I'll kind of pause between each slide in case there's questions too. Just jump in. This is a map of all of our current programs. They're divided, even though the county lines are still there, they're divided by color. You'll see the corresponding colors are regional programs. In 2015, we went through a competitive RFP process, and that resulted in the regionalization of a lot of our programs. You'll notice that they align with our hub regions as well. Quick about Healthy Families America. It's a nationally recognized evidence-based home visiting model that has 30 plus years of research that support all of the critical elements and standards that we adhere to. The research shows that implementing this model to fidelity really reduces the risk of adverse childhood experiences and maltreatment for children. HFA was developed in 1992 by Prevent Child Abuse America in development with Prevent Child Abuse America. Like I said, it's based on these critical elements. And let's see, to adhere to the model fidelity, we as our central administration, which I'll kind of explain a little bit more what we do, we provide yearly site visits to programs. We show to HFA National that our programs are in adherence to the 150 plus standards that are part of the model. And we go through a comprehensive accreditation process through 5 years. So last year we screened just under 9,000 families for eligibility. A lot of our programs, their screeners are they go into the hospitals and have great relationships with their local hospitals, and they do screenings there. We also work with other community partners such as WIC, Pregnancy Resource Centers, and other different local agencies to identify families that could be eligible for Healthy Families. And then we served around 2,500 families each year through home visits. Our program is from prenatal to age 3. So of those families, a certain part are new families every year, and then some are those that have been there for 1 or 2 or up to their 3rd year. So when you have, for HFA, when you have an accredited state system of Healthy Families programs, you are required to have a central administration office. So that's the Early Learning Division, and our HFO staff, which is currently about 2.5 people. It will go down to 1.5 people because one position was limited term duration that we currently have. And then we do have 2 contractors that work with us as well. That's a quality assurance specialist and then one of our trainers. So the difference between having a standalone HFA site and a multi-site system that's accredited is this central administration office. We provide the technical assistance and the quality assurance and the oversight to all of our programs. Where a standalone HFA program would look to Healthy Families National Office for that support. So our programs come to us for that support. We provide the HFA required training, so our trainers are certified with Healthy Families America. We provide the QA and the technical assistance and the site visits every year and all of that work. We are the work that we provide of the oversight is broken down here. I have listed out into these main areas, which is quality assurance, technical assistance, training, policy development, administration, and then evaluation. So we also have a really robust evaluation that happens every year through NPC Research in Portland. So currently, we are in the middle of our reaccreditation cycle. This happens, like I said, every 5 years for multi-site systems. And in April, we had our central administration site visit where Healthy Families America staff came to Oregon, and they reviewed all of the information that we had to present to them, showing that as a multi-site system, we are adhering to the multi-site system standards. And then we're currently, we've received our report back from them on the areas we are doing really well and the areas we need to strengthen, and we're currently working on our response back to them. So we just write a response to the areas that they are requesting we strengthen, and so our response includes how we'll strengthen that and what our plan is to address those issues. And then starting next month, in just a few weeks in July and August, 8 of our local programs will receive site visits. So when a multi-site system is going through reaccreditation, half to a third of their sites get selected for local site visits. Not all of them, there just isn't the HFA doesn't have the peer capacity, basically the reviewer capacity to come visit all of our sites, so they choose between a third and half of our sites. This year, this cycle, they've decided to go with half of our sites because we just went through this big kind of redesign where a lot of our programs regionalized. So then once that's done, they'll go through the same process that our central admin office is going through. They'll get the report and then write their response and address any issues that were identified. And let's see, and then we will go through this reaccreditation process again in 2022. Have any questions on that real quick before I jump ahead?
Good.
All right. So I'm going to talk a little bit about equity and how we work with our programs to make sure that they are offering services, offering services to in an equitable way, and really seeking to enroll families that are furthest from opportunity into our program. So all of our contracts include the ELD's equity deliverables. All of our programs did the equity assessment. That was part of their contract for this last biennium, and their goals have been, the goals identified for their agency through that process have been added to their Healthy Families Program Goal Plan, which every one of our Healthy Family programs have. Those goal plans include things from how to increase their home visit completion rate, how to increase family retention, how to engage more families. So there's an array of goals that they have on that goal plan, and so we've added their equity assessment goals into that goal plan. Service delivery priorities. This is something a little bit unique to Oregon that not all HFA programs do or state systems do. So we're required to have a target population by Healthy Families America. Oregon's target population is all births by statute. So we don't have the funding or the capacity to screen and or serve all births. So so our programs implement their service delivery priorities. They've set those based on data that they've gathered through NPC research, through working with their hubs and other local communities. And so they've determined, unique to each area, each regional program, they've determined when we screen these families and we don't have enough capacity to serve all of the eligible families, we will then start looking at our service delivery priorities and serve those families first. So, for example, if a really rural community had no other services for teen parents, they might choose to prioritize teen parents as one of their service delivery priorities. We make it real clear to programs that they're to offer services to every family they can if they have the capacity. But when they don't have the capacity, there could be many more births in 1 week than another or 1 month than another. And so when they have the capacity, serve all those that are eligible. When they don't, they utilize their service delivery priorities. And then also part of our Healthy Families America standards are that we, each program does a cultural sensitivity review every 2 years. We utilize NPC research data, and we look at who do we serve versus who lives in each region, in each county and town area. Programs will identify strengths and challenges. So where are they doing well at serving their population, and where are they having a lot of challenges? And then they create a plan for improvement that include goals and steps that they're going to take with the timeline and when they're going to do, when each of those steps will be accomplished. Okay, so 4 major kind of buckets of work. There's lots more work going on than this, but these are really, if I were to categorize them into 4 main buckets of work, it would be our current reaccreditation. We're working on developing a data system for healthy families. We are working on our new contracts that will be effective October 1st, 2017 for the next biennium. And then we're also just starting our process to do our new strategic plan for Healthy Families Oregon. It will be effective January 2018 and go through 2022. So let's see, bodies of work that I feel like would be appropriate to bring to this committee that could be really useful and some rich discussion and provide some really good input are our strategic plan, and then the cultural sensitivity review that's used by our local programs. It's, HFA tells us what needs to be in it, but they don't give us a template. So Healthy Families Oregon created a template for a cultural sensitivity review a number of years ago and has not been really thoroughly updated for a while, and we feel like this committee could be really helpful in helping us update it and make it a little bit more relevant. And then I'd love to hear from you guys on how you think you could, you see kind of this committee supporting Healthy Families Oregon. And I do have to put in a little plug, the cute little girl in the shopping cart, that is mine. I always put my kids' pictures into my slides. They're just too cute to leave out.
I knew I saw that smile somewhere before.
Yeah, cute.
I remember her when she was like a week old. I think you brought her to a Best Beginnings meeting.
Oh, I did. You're right. She was a couple weeks old. Yeah, she'll be 9 months later this week.
Yes. Very cute. Okay, well, thank you. That's a great overview, Erin, and appreciate the background on Healthy Families, which is obviously sort of the core part of the Council and Division's work on prenatal to age 3. This program really commands that space for us to a large extent. So as far as the strategic plan and cultural sensitivity review, Erin, are those under development, or do you have an idea of when you would actually bring those to the this committee?
Yeah, so right now for the strategic plan, we're just working on developing some survey questions for families, for Healthy Family staff, and then some, we also have we're hoping to actually also ask our hub directors some information about how Healthy Families works as a partner in their communities. And so we're developing those questions now, and we'll be taking those questions to our advisory committee, Best Beginnings. So I would think maybe once we get those questions, if that's something you guys would want to provide some input on, those questions themselves, or we could just bring kind of the responses we get back and how we've analyzed those and really talk through some of that with this committee. And the cultural sensitivity review, we have not updated that for a while, and we haven't started yet. It's on the list for this year of updates.
Okay, so later, this fall or winter would be that review. And I'll speak for the committee that I know from past experience, having us take a look at the survey questions has been, I think, very valuable for other questionnaires that have been sent out into the field, just to get this equity perspective on how the questions are being asked.
Okay.
This is Joyce. I agree with that. as I was listening to you, I was thinking it would be useful to have us give you some input before you finalize those questions, because what we found is that there are just little things that need to be included or excluded from survey questions that I think our committee has been very helpful in providing feedback on.
Okay, so in that process before, when you guys have done that in the past for other programs or processes, is that something that we would wait until your next meeting, or is that something that could be done over email? I'm just curious the process as we look at our timeline.
Well, we meet monthly. So.
Oh, I was just going to say, actually, I'm not quite sure how often you meet. So even if it was monthly, that would probably be sufficient. And
right.
Yes.
Yeah.
Yeah.
We're
so
going to meet in July, and then we're skipping August. So what is it, Lillian? July 18th? Is that correct?
Let me double check.
Oh, I have my calendar here. I
Yes.
can look at it.
July 18th. That would be our next meeting.
So that will sort of be our summer meeting, Erin.
Okay.
If that works for you timing-wise to have some draft questions.
Yeah, I think that would be great. I think that July 18th gives us, we were planning on having them done around that time anyway, so that would be perfect.
Okay, great. So we'll just look forward to seeing those questions, which will then be sort of the initial part of the strategic plan process, it sounds like.
Great.
Yeah. So committee members, any comments as far as Erin's second question here of how we would see ourselves supporting healthy families or again?
This is Kelly Poe. I have a question. I don't know if it's helpful or not, but I've watched healthy families in Wallowa, Baker, and Malheur counties move from their county programs into the regional program, and is hosted by a small nonprofit out of Wallowa County, which that was not a very positive experience for our region. My question is, so as it moved, what's happening in our three counties is they're trying to create one model to meet the needs of all three counties, and culturally the three counties are very different. And so my question is there an opportunity to create strategic plans where you have a hub region or a region where HFO serves that has different services in different counties to accommodate those needs? Because it seems like things are not going in that direction. It seems like they're trying to streamline it. It's really difficult for a small nonprofit to run a regional program. And I'm just wondering if there's changes or opportunities down the road.
I think that that's a really, really valid point, and I think that your program, your guys' program on that region is not alone in that process. Our RFP process required that our programs come together and regionalize. But I would love to hear more about some examples, and because I think that we can weave that in and really provide some training to our programs around that. That can be part of our strategic plan, but I think it's a really valid point that I don't think you guys are alone in that. But especially when you have these really large regions like your guys's, another one that comes to mind is Douglas-Klamath Lake. It's this huge region, and it's kind of, it would be impossible to think that the services need to be exactly the same across the board for those large regions. So yes, absolutely. I think that that's a really, that we could have a much bigger discussion around that and how we can fit that into our strategic plan for programs and make that work better.
That would be great. I really appreciate it. It's the region itself, the three counties being together and aligning with the hub region is great. That works fine. The need is, and I think it really is
part of our conversation today, and that is how do we create a model that allows for different communities, might not be a county, but different communities to receive services that meet the needs of that particular community and be cost effective.
Yeah, Healthy Families America is a pretty, as you know, a pretty prescriptive program, and there's a lot of standards that really have to be adhered to. We have to do certain things in a certain way. However, the model does also provide a lot of flexibility in how we deliver those standards and how we do that, and it doesn't necessarily have to be the same for one large regional program. I understand the need to create a regional program, and there are attempts to try and streamline some things, but there are also things that can be separated out by the local communities within that region.
Okay, so just in light of the time, Erin, can I encourage you to have an offline conversation with Kelly Poe and kind of pursue that so we don't lose that, especially knowing contracts are coming up in October?
Yeah, absolutely. Kelly, I can shoot you an email and we can set up a time maybe to talk further.
What you're doing here is great, and I'm not sure that I have a whole lot more to add, but I think it's a really good conversation for our equity committee. So I don't have concerns today.
Okay.
Thanks, Kelly. Any other input for Erin, questions, thoughts before we move for the last 10 minutes of our agenda to talking about our committee meetings? Okay, Erin, we'll look forward to seeing you again and working on some of these projects together. We appreciate being included in your process.
Great, thank you so much.
Yeah, good luck with the accreditation process. I know that's a ton of work for everybody when they show up.
Sure is. All right, thank you.
Yep, thanks a lot, Erin.
Bye.
Thank you, Erin.
Thanks, Lillian.
Yeah, Lillian, thanks for setting up those staff presentations, which were obviously very informative and a really good use of our time. So thank you for organizing that.
Okay.
So in the last 9 minutes that we have, as always, things run long because we have lots of good input. Lillian and I wanted to talk with the committee about our proposal that we discussed at our last meeting of our meeting structure and sort of the format that we are proposing for the coming year starting in September. So what we've talked about is meeting still monthly, except for August. We're going to take August off for the summer. So we'll meet July 18th and then come back in September. And what we talked about doing was alternating in-person meetings 1 month and then online meetings such as this one, the alternate months. And we talked about starting this in September with an in-person meeting in Portland. So that when we talked to Kelly Poe about the fact that she's in Ontario, Oregon, which is a 6-hour drive, or a 1-hour plane ride, or 45-minute plane ride. Kelly indicated that Portland would be the best site for her to meet if we aren't all going to fly to Ontario, because that's where the plane lands at PDX. So trying to accommodate Kelly being able to get to these in-person meetings would suggest that at least initially we try to do the in-person ones in Portland. And another change, and then I'll stop talking and get feedback, is to start to run the meetings from 9:30 to 11:30 instead of 9 to 11. And once again, this is trying to accommodate airplane schedules. So those are the 2 questions. Can people adjust 9:30 to 11:30 instead of 9 to 11? And how does it sound to start our in-person meetings in September in Portland and then alternate from there? Is there anybody who cannot adjust the time of the meeting by that half hour?
Yeah, that's good.
All right, so July will still be 9 to 11 because it'll, yes, 9 to 11. And then starting in September, we will just move it half an hour later.
Okay, this is Joyce, and
Yes.
as I was, just reflecting on this meeting, it seems like we're always running out of time, and that's a good thing because we're always seeking clarification or providing input. So my concern or my question is, how do we structure our meeting so that we can get through our agenda? Because as I was looking at this agenda, actually, it takes up 2 hours and 15 minutes.
Oops.
Yep, sure is.
Yep.
Yeah, 60 minutes.
Right.
I'm sorry.
Right?
Yes, you are right, Joyce.
I miscalculated.
Yes, you did. But I mean, I think that at least I'm feeling like, a year ago, I was really concerned about, we're not really accomplishing anything substantive. Now I feel that we are definitely on the road. We're on the right track. And I'm feeling very engaged and being used to, provide feedback that will improve our system. And so I just want to make sure that we're allowing ourselves the time that we need to raise some of the questions or provide the feedback that will be useful to our presenters. And we've had some good presenters, and I want to just say that I thought I liked the presentation that Erin just did. It was clear, it was concise. I liked the PowerPoint. And so, I guess what I'm trying to say is, are we allowing ourselves enough time to do the business that we want to do? And if we're not, do we cut back on the work sessions and make them, focus on, like today we had three works, so this is the third one. Okay. But anyway, just making sure that we can provide the valuable input and get the information that we need in the time that we've allowed.
Yeah, very valid point, Joyce. And I guess, Lillian, maybe you and I can work a little more closely and see, as we put agendas together, if we've allocated enough time anticipating what input the staff's going to be looking for, and also what the timing is. If something's urgent, then we've got to get it on our agenda. If something can wait another month, we could push it off for another month. I don't know,
Yeah.
Lillian, what are your thoughts?
Well, I would have to say, with this new system that we have developed, the docket is every month the docket would be full. So it's hard for me to kind of consider having one less work session, knowing just the sheer amount of requests that we're receiving. And if you've seen from our work plan document, just the amount of work. So I guess for me, I would suggest at a minimum we maintain the meeting time, if not add more time, in order to accommodate the amount of work that we're receiving from across the division, and multiple projects have time-sensitive timelines. So even if we had to bump something, we would be bumping into other timelines. So.
Okay.
Well, what I guess I didn't say this, I kind of beat all around the bush, but maybe we need to consider maybe just adding another 15 minutes. That might work for it, because we are kind of 1 minute from stop time. And if we had an extra 15 minutes, that might do it.
So schedule it for 9:30 to 11:45 as our regular schedule. How do people feel about that? Can people allocate that much time for this Okay, I'm hearing nobody jumping up and down saying
Carmen
can't
says
work.
that works for me.
Okay. Oh, good. Thank you,
Works for
Carmen.
me.
Okay, well, great suggestion. If there are no objections, shall we start that in, do you want to start that in July or in September? So should we do it immediately, Lilianne?
Well, I would suggest starting it maintaining our current schedule, starting in September, just to nod to our other committee members that's not on the line right now, and yeah, and we'll incorporate into our upcoming.
But Lilianne, this is Joyce. We already have somebody who was from this meeting who's going to be coming back next month. So.
Say that again, Joyce.
I said, isn't Aaron going to come back with something?
Oh.
Yeah, so we're already having somebody that we've added.
Okay.
For the July.
Well, I gave my suggestion, but if the committee feels like they would like to add the additional 15 minutes, then that's fine with me. We'll just change the time on our meeting notification.
Okay, so what I'm hearing is that we will meet from 9 to 11:15 on July 18th, and then starting in September, we'll meet from 9:30 to 11:45. Okay, and I apologize, we ran out of time and have not covered the work plan. Once again, if you've got any comments after reviewing it, please send them to Lilianne so that we can incorporate them in what we hope will be an agenda item on July 18th. Okay, it is 11:01, so Lilianne, we're done? Nothing urgent?
Nothing urgent on my end.
Okay, thank you all very, very much for your time and input. You're very valuable. Have a great day.
Yeah, you have a nice holiday.
Thanks.
Yes.
Bye-bye.
Bye-bye.
Bye.